What is frozen shoulder? Frozen shoulder is also known as adhesive capsulitis or a 50-year-old shoulder. The shoulder joint is a golf ball sitting on a golf tee. Around the golf ball and golf tee, there are a front door, a roof, and a back door that consists of two tendons, somewhat like a house. Above the roof tendon, there is a piece of bone called the acromion. Within the shoulder joint itself, there is a capsule. Think of it like a balloon that contains the fluid within the joint. Sometimes, when the roof tendon is damaged, from the branch bone, the bone on the top, rubbing on the roof tendon, the capsule can become swollen and inflamed. Essentially, think of it as the wallpaper inside the house being thickened and swollen and inflamed. That is frozen shoulder. And as its name suggests, during frozen shoulder, the shoulder is frozen. So you will get decreased range of motion both actively, which means moving it by yourself, or passively, which means using the other shoulder to lift up. Typically, the motion that is most affected first is what we call external rotation. So comparatively, you will have one shoulder that is stuck like this, while the other shoulder being able to externally rotate completely. The shoulder will go through three phases. The freezing phase, where it's painful and becoming stiff. The frozen phase, where it's extremely stiff but no longer painful. And the thawing phase, where it's relaxing. The entire duration may last 2 to 2.5 years. Our job is to accelerate that. You can either go through medication with physiotherapy or intra-articular, which means into the shoulder joint injections, essentially injecting into the house to reduce the swelling and to melt away the wallpaper. Or lastly, through a keyhole technique, we can release the wallpaper or the capsule to allow you to get good range of motion again.